New Jersey, masks are required everywhere that you cannot socially distance. All right, so the governor there said that he hoped to avoid having to do this order, but that an uptick in the number of cases he felt like left him no choice.
But unfortunately, we have been seeing a backslide in compliance as the weather has gotten warmer, and not surprisingly, as a result, our rate of transmission has similarly crept up. Wearing a face covering, I remind you, is not about politics. It's about quite simply being sick or being healthy.
Now, outside diners, people who have certain health conditions and children under the age of 2 are exempt from this order. That's New Jersey. Also in New Jersey is Dr. Jennifer Caudle, who is a family physician and an associate professor at Rowan University in the state. Hey, good morning to you. Did you notice there's this new study about cloth masks, and it says that they may not be as protective anyway as medical grade kind of masks, at least for caregivers, for healthcare workers. But I tell you what, the cloth masks are the ones that the rest of us were like, oh, I need to get a cloth mask, a more permanent one, so I can wash it and wear it all the time. So what did you think about this study?
Well, no, you're exactly right. We do know that medical grade masks like N95s are actually, they're more effective masks, and they are the ones that are recommended for healthcare workers for really good reasons. We know that wearing a mask, a cloth mask, is a wonderful thing and an important thing for people in the community to do because it decreases spread of coronavirus. It basically saves lives. So we want to save those N95s and those medical grade masks for the healthcare workers because, again, we have cases surging throughout the country. We need our healthcare workers to have those masks, but it is important for everyone in the community to wear cloth masks. They can be washed and reused. The University of Washington says that if 95% of people wear masks by November 1st, we could potentially save an estimated 45,000 lives. Masks do save lives, and I'm really happy to see a lot of the mandatory mask sort of mandates that are happening throughout the country. I think it's the right direction. We have to be wearing masks.
45 souls that could be saved through us deciding to wear our masks. That bears repeating, doesn't it? You teach there as
right.
Yeah. You teach at a university there. Do you anticipate that you will actually be teaching in person this year?
Yeah, so we've actually started classes, med schools, we tend to go year round. And so our third year medical students, I teach a course for third year medical students. We started actually this Monday, and our whole world is just as different as everyone else's. I gave my orientation lecture and our lectures on Monday through Zoom and through WebEx, as opposed to in person, which we normally do every block, every quarter, every year. Our students, again, we're a medical school, so it's a little different. We're not, say, a public school, but yeah, our students are going back to the rotations, going in the hospitals in some cases and in the offices, but many students are also having the experience of telemedicine, distance medicine through phone, electronics, computers, which is, even as doctors, we're having a hybrid model. We're not only seeing patients in the office, we are doing that as well. All of this is a sign of the times being changed and being different because of coronavirus.
Yeah. Are there precautions that you would like to see in place that would make you as an instructor feel safe, like in a classroom setting?
Well, always. And so, I have to understand that I don't want to say that my classroom is different than, say, the classrooms of public school teachers throughout the country. We're sort of in the middle of these discussions about back to school. But the point is, no matter what classroom we are talking about, there do have to be safety precautions put in place. And that's for any classroom, and especially public school and school teachers and school classrooms as we talk about back to school. Our teachers in our schools, they need safety precautions. They need leadership. They need guidance, they need regulations, they need funding, they do need safety equipment. So all of this is very, very important, literally for any and every classroom.
Dr. Jennifer Caudle, thank you for instructing us this morning.
Thank you.
Appreciate it.